This is an instructional video showing how to use MamaBirthie CS to practice a cesarean delivery. For this simulation, you'll need MamaBirthie CS with the CS module, including the uterus and abdomen skin, and BabyBirthie with placenta. In addition, you'll need personal protective equipment and surgical instruments that are not included. You'll need a printout of the WHO Surgical Safety Checklist, scrubs, drapes, swabs, suture, and an instrument kit for cesarean section. To set up, connect the CS uterus to MamaBirthie and position BabyBirthie inside the uterus. Cover with the abdomen skin. MamaBirthie CS can be used on a tabletop to demonstrate skills, but it's most effective when worn during simulation. The team of learners should now prepare for the operation. Scrub in and put on sterile surgical gloves and gowns. One learner will take the role of the checklist coordinator. Team members should introduce themselves and confirm all preparations are complete. Use the timeout section of the WHO Surgical Safety Checklist or local protocols. Check that anesthesia has been effective by pinching the skin with forceps. Palpate important landmarks to identify the incision site. A Joel Cohen incision is placed 3 centimeters below the line that joins the anterior, superior iliac spines. Use a scalpel without knife to simulate a horizontal incision of approximately 12 to 15 centimeters to open the skin. Open the subcutaneous fat from the midline and widen the incision manually, avoiding the inferior epigastric vessels. Open the fascia from the midline and extend the incision with your fingers. Separate the rectus muscles bluntly and pull them to either side. Open the peritoneum bluntly and stretch all layers to the size of the skin incision. Insert a bladder blade and visualize the bladder. If it's positioned high, perform a bladder flap by dissecting the visceral peritoneum, and bluntly reflecting the bladder. Make an incision of 2 to 3 centimeters. Incise the uterus carefully to avoid cutting the baby. Then bluntly extend it, pulling outwards and upwards. Remove the bladder blade from the incision and insert one hand to deliver BabyBirthie's head. An assistant should provide pressure on the fundus to help deliver the baby. Try the baby and check for breathing. If the baby is breathing well, wait at least 60 seconds before clamping the cord. Hand the baby to the midwife, who will initiate skin-to-skin care with the mother if possible. Ask the anesthetist to give uterotonic according to local guidelines. Deliver the placenta with controlled cord traction and check that it's complete. If it's recommended by your local guidelines, you can exteriorize the uterus. Clean the uterus thoroughly before closure to ensure there are no parts of the placenta or membranes left inside. Clamp the angles of the uterus to approximate the edge. Close the uterus with a continuous suture. Check for hemostasis by cleaning the incision site with a swab. Remember to check that the ovaries look healthy. Clean the abdominal cavity and insert the uterus. Before closing the abdomen, check that the swab and instrument count is correct to ensure nothing is left inside the abdomen. Clamp the angles of the rectus sheath. Then, close it with a continuous suture and check for hemostasis. Now, close the skin and cover the wound with a dressing. Before the patient leaves the operating room, confirm the instrument count is complete and discuss key concerns for recovery and management of the patient. Use the sign-out section of the WHO Surgical Safety Checklist or local protocols. When the simulation is over, remember to remove the sutures to prepare the simulator for the next use.